Somatic tracking, or being aware of what your body is doing or your body's sensations, is an important part of managing stress effectively. When we are aware of our body and sensations in our body, or what our body is doing, this allows us to use that information to manage stress more effectively, to take steps to prevent stress from affecting us or not affecting us as much. It's all too easy to be busy throughout the day with all the things we have to do, all of the demands that we all face on a daily basis. And sometimes that can lead to us ignoring our bodies, ignoring what's going on with our bodies, what we're feeling with our bodies, the sensations that we experience in our bodies. And as I said, those can be tremendously telling. They can be a clue that something bigger is coming. They can be a clue that you are experiencing a stressor that maybe you're not even aware of yet, but your body has already picked up on it, is already aware of it, and is talking to you, telling you that something bigger is coming, perhaps a bigger reaction that you don't want to experience, perhaps something that is a warning sign that would then allow you to take measures to protect yourself. So paying attention to those somatic clues, your body's signs, or your body speaking to you, communicating with you, can be tremendously helpful when it comes to effective stress management. When it comes to somatic tracking, the idea is to be an observer, not a detective, not someone that's too harsh or too involved in it. This is not about judgment. This is not about fear. It's about awareness. It's about learning, gathering information, and then using it for your own benefit. So remember, as you begin a practice of some kind of awareness of the sensations in your body, be gentle with yourself. Remember, you are an observer. You're here to learn, to gather information, and then to translate that information into something that will serve you, that will help you, that will protect you. You're not here as a detective or a judge of any kind. We're simply observing and learning. The sensations in our body are there for a reason. The body does what the body does. And this is the kind of attitude that I want you to be able to have when it comes to somatic tracking. But with that comes the knowledge, the understanding that while, yes, the body does what the body does, it's also speaking to you. It's also giving you a message. It's trying to tell you something. Take it for what it is, and then use it for your own benefit. Beyond being able to be aware of these bodily sensations and then use them to your benefit in terms of effective stress management, the other benefit of doing this is that you become not only aware, but also used to these sensations, used to your body doing what it's doing, so that it's not so scary or new to you anymore, because now you have experience with it. What are some examples of sensations that you may experience in your body? Sometimes you might feel jittery. Sometimes you may feel flushed or hot, or maybe you may feel chills, just the opposite. Sometimes you may feel like you have an abundance of energy and maybe you can't stop moving. Sometimes you may start yawning and have a difficult time stopping, even though you don't think you should be feeling tired or sleepy. It may be situational. It may be stress related. So this is just a very short list of the kinds of sensations that you may be experiencing in your body. When you are practicing somatic tracking, it's important to figure out, where is the sensation? Is it located in a specific part of your body? Is the sensation localized? Is it small or is it big? Does it affect a greater area of your body or maybe your entire body? Does it feel hot or cold? What other physical sensation can you identify? And when you're doing this somatic tracking, it's important that you're paying attention to what you're experiencing and letting it happen, letting it pass. Now, of course, this is very different from any situations or any instances where you may be experiencing a medical emergency. Don't wait around and wait for it to pass then. This is when taking action and seeking medical help is necessary. So there's a very big distinction. Do not confuse the two. This is simply paying attention, recognizing and experiencing sensations in your body. This is not the same as anything that may be considered a medical emergency or an urgency where medical care should be sought out. So it's very important to distinguish between those two. When you are experiencing these sensations within your body, understand that they may be the first step or a warning sign or a red flag for something more to come in terms of a stressful experience or a response to a stressful situation. This can be especially helpful when you have already experienced the full range of whatever the situation may be. For example, if there is a sensation that you identify in your body that has in the past led to something like, for example, a panic attack, you can then use those first warning signs, that first red flag, to prompt you to do something that will counteract whatever is happening to you, whatever is causing your body to react this way. Something as simple as practicing some breathing exercises, for example, may be enough to calm yourself before you go into that phase where you might experience a panic attack. So this might be using that very first warning signal as a prompt to do something to prevent things from progressing. So doing something like breathing exercises may be a good option for you. Let's say you have a meeting and maybe you are expected to lead the meeting or speak in the meeting or give a presentation, and you're feeling the stress of that. Pay attention to your body so that you can recognize at which point that stress begins to affect you, at which point your body starts to give you those clues, throw up those red flags, alert you that a bigger reaction from you may be coming, and then take that opportunity to do something, to engage in a practice that you find particularly effective in lowering your stress response. Maybe you find yourself in a traffic jam and you're in a hurry or you're already running late. pay attention to what your body is doing and what it's telling you, and then again engage in an appropriate practice that would help you to calm down and counteract that stressor of being stuck in traffic before it spirals into something bigger, before it affects you more, before you have a bigger reaction. I mentioned breathing exercises because they are so easy to do and they can be done pretty much anywhere at any time. You can keep your eyes open, especially when you need to have your eyes open, but you can breathe, take in some calming breaths, do some breathing exercises without really disturbing anyone else or without other people even being aware of it most of the time. So that's why I mentioned breathing exercises as a good option. But you by now should know yourself what works well for you, and hopefully your stress management toolbox is pretty full and has many options for you from which to choose. So remember, use what is appropriate in the moment. Use what is effective and what is helpful to you. I suggest that you start practicing paying attention to your body on a regular basis, on a daily basis, and don't wait until you have a potentially stressful situation. Learn to pay attention to your body so that you can learn to better understand what it feels like when you're not stressed. What is your body doing when you're relaxed? So that when your body does what a body does in response to stress, you can pick up on those clues, on those cues, on those red flags much quicker, because by practicing somatic tracking on a regular basis, you will get to know your body and get to know what is normal for your body during a peaceful, relaxed time, so that you can then more quickly and more readily tell the difference when your body is trying to tell you something about stress. If you'd like to learn more about a comprehensive approach to stress management, check out the links below.